Okay, so let's finish in the thoracic and rib cage area with the sternum. So the sternum has three major parts to it. It has the upper portion, which you can see on your notes, this upper, it almost looks like a badge, if you will, called the manubrium. Some people pronounce it manubrium. Then the majority of the sternum is called the body. And then the inferior tip is called the xiphoid process. So a good way to look at this, I'm actually going to draw this structure over here because a lot of the diagrams don't really show this structure properly. So this right here, this is that upper shield. Let me not shift that over so far. So this is the manubrium. Okay. Now there's a few structures here. We can see there's a notch right here. This notch is for the articulation of the first rib. So I'll just put a little tag here. We'll talk notch for first rib. Okay. Now, when we come off of here, this structure right here is very important. So I'm going to bring this over here and tag that notch. This portion, if you come down and feel softly on the front of your throat, right at the top of your sternum, you're going to be able to find this little divot that your finger can set in. If you rock it from side to side, there's these little horns that stick up. This right here is called the suprasternal, or we call it the jugular notch. So suprasternal notch or jugular notch. I don't care which one you put on your test. I don't care if you put both. Now, coming down at the base of the manubrium, the base of the manubrium is going to articulate with the body of the manubrium. I'm sorry, the body of the sternum. Excuse me. Okay, so this is the body. Okay, runs all the way down. Most of our rib cartilage attaches to the body. Then there's this point right here where the manubrium and the body meet. This is called the sternal angle, sometimes even called the angle of Lewis. Okay, we can see in our diagram here, this is where the second rib comes down and attaches right in through here. Okay, all right. So then on the inferior tip, we're going to have this structure called the xiphoid process, or just the xiphoid itself. Okay. Oh, sorry. Xiphoid. Now the xiphoid is the inferior tip of the sternum. A lot of times it's bone and cartilage combined. It just depends on the person. So you need to know the manubrium. You need to know the suprasternal notch for the manubrium. You need to know the sternal angle. So we'll put stars next to that. You need to know the body, and you need to know the xiphoid. And that's our sternal structures. Ribs 1 through 7 attach directly through to the sternum. Ribs 8, 9, and 10. Their costal cartilage on the anterior side attached to the costal cartilage of rib 7. Okay? That's our thoracic spine, our ribs, our rib cage with the sternum.